Hey everyone, David here, and I've got some exciting news to share. I've decided to write a book, and I've entitled it Psychosocial Hazards Are Real. The book is intended to help clarify the fact that psychological safety cannot be achieved without paying attention to the psychosocial hazards people are being exposed to. Despite how much individuals might be interested in treating others with kindness, dignity, and respect, many cultures are so full of psychosocial traps that no psychological health and safety effort can ultimately succeed. But to address psychosocial hazards, you first have to know what they are, and you have to have some idea what to do to address them. Though the book won't be 100% complete until the spring of 2025, I'd like to share a unique opportunity to reserve a copy during the book presale campaign. The campaign will run from September 16th to October 18th, 2024. This will be an opportunity to get one of the first copies of the book, tickets to the book launch event, and other opportunities to learn more about psychosocial hazards. For more information, you can go to my personal LinkedIn or Facebook page, or the LinkedIn, Facebook, or webpage for ID2 Solutions. Don't miss out on this unique opportunity. Now, back to this episode of the podcast. One fundamental difference between the public and private sectors is the fact that the public sector is often responsible for high-risk activities that are not financially profitable. High hazard also means high psychological and physical risk. We'll talk about safety in the high hazard segment of the public sector up next on this episode of the Psych, Health, and Safety USA podcast. From Flourish DX, this is the Psych, Health, and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this week's Psych, Health, and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. So the public sector, work in the public sector can be high hazard due to a number of factors, including public employees face a variety of both physical and psychological hazards. On the physical side, it includes exposure to toxic chemicals, blood-borne diseases, and indoor air pollution. Public employees are often at a higher risk of assault and violence from the work that they do with clients, patients, and others. State and local public sector employees are 64% more likely to be injured than their private sector colleagues. Public sector workers also face many mental health challenges, including workers, especially educators and healthcare workers and law enforcement officials that experience trauma and secondary trauma from their work. Secondary trauma is the emotional distress that often occurs when hearing about someone else's traumatic experience. Workers are often exposed to life-threatening situations and emergencies, which can lead to job-related stress. That's the focus of our conversation. And again, it's another one that is somewhat important to me, having spent a lot of time in the public sector. And my guest today also is currently in the public sector. And we also have a couple of other similarities that we may talk about. So let's get right into it with an introduction of my guest by my guest, in this case with this question. Who is Cory Worden?
Cool. Hey, well, good afternoon. Good to see everybody. I can see everybody. If we haven't met, somewhere in the world, I'm Cory, and so uh, the short version, I've been doing this for about 21 years. As of last May, so for all intents and purposes, I started in the United States Air Force back in 2004. I had essentially, I was going to college at the University of Houston when 9/11 occurred, and so I went down to the advisor and I asked what the fastest way I could, you know, walk away from college with a bachelor's degree was, so I could go down the street to the recruiter. And my wife, who was my girlfriend at the time, she had given me a very clear directive that she wasn't going to marry me if I didn't have a bachelor's degree, and so I figured I'd make it all work out. So I was able to get a degree in communications very quickly, and I went down and enlisted. And so I got to the Air Force, and originally I had enlisted as a meteorologist, or they call it a weather forecaster is the official name they call it. But I didn't make it through training because apparently I don't have any depth perception, and didn't know that until I was 6 months into this course at Keesler Air Force Base. And so they gave me two options: is, you can either go home and call it a draw, or we can put you in something else as based on the needs of the service. And I took the second option because I didn't want to go home. And I actually got really lucky. They put me in a field that at the time was called disaster preparedness, and now they call it emergency management. And so essentially, it's the Air Force's version of FEMA, but for the first couple of years before you get to work in the emergency operations center and before you get to do a lot of the, macro level emergency management work, you're essentially a CBRN responder. So you do all the hazmat response that's not handled by the fire department. So that'd be anything involving unknown chemical hazards, biohazards, especially at the time. There was a lot of concern about things like anthrax, and then any kind of radiological dispersal devices. And then we do all the nuclear plotting for any kind of radiological fallout or downwind hazard distance. We don't do explosives because the Air Force has EOD, that does all that. But we do all the unidentified explosives and unexploded ordnance and things like that, as far as identification, cordon, and the management part of it. So I got really lucky with that, honestly, is that I was able to do that for 6 years in the service. And then when I got out, I kind of started doing the math, and I realized that a lot of what we did, especially involving respiratory protection and a lot of the contamination control procedures and things of that nature that we were doing, and as well, I had taught all that as an instructor in the Air Force, was, a lot of the same kind of thing that goes on in occupational safety and health. And so I was really lucky at that point. I was able to get a job as a safety coordinator. We were doing a factory build. So we did the construction project, and then we did the transition into factory operations that included ISO and all that good stuff. And then from there, I had, when that project ended, I went over to the city of Houston the first time. And at that point, I was doing a lot of work with the Houston Public Works, as well as the Parks and Recreation Department, which they got a lot of pesticides and things like that. And I did that for a couple of years, and I had an opportunity to go into healthcare. And this was actually, I got a really good lucky break. Is I went over to the Memorial Hermann Health System, which at the time didn't have a department for occupational safety. They had infection prevention, quality, patient safety, and they had an industrial hygienist, but there wasn't necessarily any kind of focus on occupational safety. And so I was brought in to do that. So we did that really lot of very aggressive work for the next 5 years. And that was a really good experience because I got to put everything together involving, everything with emergency response, occupational safety, and now healthcare. So I was really lucky that I got to do that. And uh, for a lot of reasons, going into 2018, the biggest one is I had a lot of personal illness at the time. So I took a year off between 2018 and 2019. And then when I was able to work again, I went back to the city of Houston, which, again, a really, really lucky break there is that went back to the city. And this time, because I had been in healthcare for 5 years, I was able to work with the public health department, the Houston Health Department, which they're outstanding. I've had nothing but good experiences there. And so that coincidentally was about 4 months before the pandemic began. And so when that all began, the emergency management for the city had asked the health department if if y'all have somebody that knows about respiratory protection and contamination control and all of these different factors. And so I got, directed over there. And so we did a lot of work with them for the next several years. And then at that point, the the city's interesting is that we have a direct line to human resources, and then we have a dotted line to the departments that we work with operationally. And so, because of all this work that was going on with public health, as well as the EMS and the emergency managers and everything, the HR department had decided to create a separate um, section. So, in the past, we had a safety manager that did all the occupational safety. We had a safety manager that was specifically focused on public works. And so they created a third safety manager position that was going to be focused around anything involving chemical, biological, radiological, nuclear, or explosive risks. And so that's where I am now. So I work with anything involving sea burn throughout the city, and then I kind of my home base, I guess, if you will, is the health department, fire department, police department, and emergency management, as well as what they call the Houston Emergency Center, which is 911 dispatch. So I manage that, and then my team, I have somebody that's uh, their full time job is to work with the health department, somebody that full time works with fire, someone that full time works with police, and then I kind of pinball between all of that, you know. So I've just been really lucky. I'm glad they do the work, and I hope that we have something good to offer the world for it.
Wow. Wow. It sounds like the typical story of the accidental safety professional that, somehow, a couple of really interesting breaks also turn out to be good for other people and good for you. So, before we dig a little bit more into the work of being a professional in the kind of in the safety world, tell me, what does psychological health and safety mean to you?
That's enormous. I know we've talked about this in several different forums, and so I'm definitely glad to know that we're like minded about this because it needs more attention. And so I look at it as a large scope. Kind of like when we talk about workplace violence. There's a large scope, and so in this case, there's a lot of what people tend to think about, which is things like post traumatic stress and um, as far as any kind of secondary trauma, and you referred to it earlier on your intro. But at the same time, there's also a lot of job related stress that doesn't get talked about. At least it didn't in the past. And in a lot of cases, especially when you're talking about people that are on the front line, so to speak, in the past, it was often viewed as a weakness, or a liability. But in actuality, if you look at something like hazing or workplace bullying. I know the word bullying often gets associated with grade school and whatnot, but it's absolutely there in the adult world. And in my experience, I've been very lucky. I'll preface with that, but I've also had some experiences that I would certainly like to wipe off the memory. And so I feel like if there's a larger discussion around that, then number one, as far as the safety aspect, there's much more awareness regarding the different risks and the awareness of those risks and the protocols and the what's needed to either control or mitigate those risks. But at the same time, it gives people much more confidence and comfort in feeling okay to call out when something is concerning, or if something seems, I always use the word sketchy. If the spider senses go off, and you feel like something's not right, it's okay to say that. And we've done a lot of work around that as far as making sure people know that number one, it's okay to call it out. You're not going to get in trouble. If someone tries to go punitive on you, then please let me know, and I'll absorb that. Um, and then one of practically speaking, one of three things. You've got either we'll make it safe through procedures, PPE, and equipment, procedures, PPE, or other methods, or if it's completely beyond mitigation, then we'll tell you to stop doing it, and just avoid the risk, or we'll explain here's why it's already safe, in terms of, again, equipment, procedures, PPE. And that way we're on the same page. So it alleviates that perception that we're trying to get you to do something that's unsafe on purpose. Um, and so if we can just take those logical steps so that generally, holistically speaking, people feel better about what they're doing, especially if there's a lot of things going on that are intrinsically stressful. Like the example, like I just taught the new employee orientation last week, and one of the examples I said, there's a lot of talk about, you're going to hear about the pandemic, and you're going to hear about epidemiology with an unknown emerging pathogen, and you're going to hear about, you know, um, responding to, doing doorstep triage, and, you're going to hear about all this. I said, but also bear in mind, I said, there's a lot of stress involved with, we put together uh, a shelter or a warming center when there's a hard freeze going on, and we bring in, and I don't mean this in any kind of derogatory way or anything, but we bring in 3,000 of the unhoused population in the same building. It's going to be an interesting experience. Especially if you've never been around something like that. But there's that mental preparedness part of it, and that goes into the psychological safety. So any way we can benefit that is, it's worthy cause. It's a worthy cause. And I'm happy to help however I can.
Yeah, so much there, so much there, and you hinted at a couple of parts of it when we talk about. Um, I find it interesting that we have a globally harmonized approach to handling chemicals, and have a no approach at all to handling how people feel. None. I mean, there isn't really. There's just now there. There's the ISO standard. There's lots of conversation about mental health. There's the Surgeon General's work. There's all this stuff out there, but it's not really harmonized. Like, we do a better job of protecting people from chemical exposure than we do protecting them from psychosocial hazard exposure. It's not even close. It's not even close. And a lot of it has to do with the rather objective nature of a chemical. A chemical is what it is. It has atoms and protons and neutrons and all this stuff, and it kind of is what it is. And the effect that it will have on another human being is really the same. I mean, it'll if it's a if it's a material that has radiation, it's going to be radiation to you, me, everybody. It's just radiation. I mean, and if you don't either, separate your time, distance, and shielding, that's it. It doesn't matter who you are. See what I mean? And when we talk about psychosocial hazards, because they are so unique to the person, I think that's part of the challenge that we have is they're really unique to the person, and that kind of requires us to see each other as human beings and to see each other as different and be okay with that. And be okay with it and not see that as somehow derogatory, or it is simply difference does not mean deficiency. It just means different. That's all. There are folks in communities across this country who don't have a house. They just don't. And some may never have a house. But what they do have is a need to be protected from a physical hazard called cold. And so those objective things are kind of easier for us all to deal with. And this psychological stuff seems squishy, soft, all that other, but it's just as important. And I can make the argument in some cases, it's even more important because, and I love the way that you talked about how you're trying to prepare the folks who are going to go into, shelter work or doing emergency management or doing emergency response. They need to know up front that there are going to be mental, emotional stressors. There may not be anything physical for real, but it's going to feel like it is, just because of the environment itself. So just a wonderful way of approaching it. So talk a little bit about, you've talked a little bit about how you ended up in the safety space, but let's dig a little bit more. What's caused you to stay connected to the public sector and the high hazard side of the public sector? So you not only do you do public sector, You could have stayed with. There's parts of the healthcare system that are not really near as hazardous as fooling around with chemicals and radiation. So how is that how's that worked out for you to stay drawn to that aspect of the public sector?
Yeah, that's an interesting part. My wife has asked me that on several occasions. She's like, "Is this really necessary?" She's like, you're getting older." Um, I guess the best way I could say it is, there may be a couple of factors there. Is the first one is that this is what I kept thinking when the pandemic was coming up. Going into the winter of 2019 and into the early part of 2020 is I had told myself kind of like subconsciously I was really pretty sick for a while, and so when I got to go back to work finally, I had kind of subconsciously told myself, I was like, okay, I'm gonna I'm gonna do this smart. I'm not gonna throw myself back into the fire, and proverbially speaking. um and So I know the things that in the past that had kind of caused me concern or distress or whatnot. So I'm going to work around those things this time. I have a second take at this. I don't. I know how to do it smarter. And then the, the pandemic has started to come up on us, and I don't mean this to sound arrogant at all. I'm kind of trying to watch my words. I don't want to come across as arrogant or narcissistic, but um, so at that time, the precedent was that you have occupational safety over here. Over here, you have first responders, and there wasn't any expectation to cross over like that. So I could have just kept my mouth shut and sat in the corner and been, you know, I'm going to continue doing facility inspections and checking for slip and trip hazards, and I'm going to continue teaching defensive driving, and nobody would have thought much about it. They say he's a occupational safety. That's what he does. Um, but I was concerned that number one, I didn't want to, look back on this one day and feel like I didn't do my part because I knew everybody was about to have to pay the bill for this, and I didn't want to regret anything. And the other thing is, I felt like I had some unique experience that was, particularly qualifying. For example, we did Ebola in 2014 when I was at Memorial Hermann. We had done all of those operations in the Air Force. That were We got real lucky. We never had any real sea burn threat, but we had a lot that could have been. We responded to them just the same, and we did do live agent training with sarin and VX and ricin and anthrax. So I felt like if that prepared me for anything, it was to be able to do something productive during this situation. And so I went ahead and did that, and then once the cat's out of the bag, and then oh he knows about this stuff, then that's what I do now, which is great. And then the other part of it, I was actually laughing about it. I don't mean to sound like a joke because it's not a laughing matter or whatnot, but I was talking to the good people over at the VA, and um, they were asking me the same kind of thing. They said, um, the topic we were talking is kind of like this with psychological safety, and we were talking about the concept of pushing back on toxic culture, and they said, "Well, do you feel like?" They said, "Do you engage in these things because you feel like it's either fight or flight, like you have to fight back, or something bad's going to happen?" I said, "Well, it's two things." I said, "I'll just be honest with you because why not?" I said, "The first thing is, yes." I said, "There's a lot of situations where if we don't push back, there's a chance that someone will either purposefully or not on purpose, whether it's a rational choice or not, someone may do something unsafe or even violating regulations or whatnot. So we do have to push back on that." I said, "Then the other thing," I said, "there's a part of me," I said, "I just, you know if nothing else, that there's um, there's there's um, there's certain gratification, in it's like you identify there's a situation here. We're going to resolve this situation, and then being able to find a way to do that. Um, it's There's a certain gratification in that. So it's almost like that old song lyric. They say you live to fight when it's all you have. So it's like if you're going to go to work every day and you're not going to get paid a lot. There's no fame and fortune. Hey, if the most gratifying thing about this is that you get to win you know a not a fist fight or anything, but you get to win a administrative fight, then yeah, let's do it. Let's keep fighting it.
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
Yeah, I've again a lot of corollaries between, or particularly your experience in the military, and bringing that back to bringing that back to the to civilian life. There's just so many opportunities to be able to use those skills, and as you were talking, it caused me to think about the similarities between response to chemical related hazards and biological hazards and psychosocial ones. The connection is often they are things that you can't see. You can't see it with your eyes, but you can sense it a bunch of other ways. So you could smell something that's weird. You can, there's something when you taste something, it tastes kind of funny, but you just can't see it. And then there are those both chemical and biological agents that you can't see, taste, or anything. You just start feeling sick because you've been exposed to it. And I think those are actually some of the examples that I use when I talk about a psychosocial hazard, because it's and you probably could rattle off one off the top of your head, but pick a chemical or a biological agent. You can't smell it, you can't taste it, it's like almost invisible, but it'll make you really sick or kill you. And psychosocial hazards in many cases are the same way. Now they aren't often kind of acute type situations. They're really much more chronic. And the two acute ones would be, and you mentioned them earlier, I'm not sure whether we're on or off recording, but the acute examples of psychosocial hazards are bullying and violence. Those are the acute, but most of the other ones are really chronic. They're around, they cause you to feel bad, to get depressed, to get anxious, and it happens so slowly that sometimes people don't notice that they're being affected. And in other cases, you can actually build up a tolerance. Again, same thing with a chemical. You can build up a tolerance to exposure to a chemical. Doesn't mean you're still healthy. And then you end up with cancer or some other thing because you've been exposed to it for a really long period of time and didn't really notice it. So it's a really interesting connection. And if we could just get people to see, again, at least I guess that's my cause to live, is to get people to see that people who go to work or to go to, even our other non-work activities that are constantly stressed in what they perceive to be negative ways, it's just not healthy for them. It's not. And it's not going to get healthy for them until they feel like it's not threatening anymore, until they feel like, and it's all about how they feel. It's legitimately and really all about how they feel. And organizations, at least in my view, ought to be concerned enough, because you can probably do something about that for cheap. It's pretty easy to do, simply being concerned. Now, the policy might cost you money, or the equipment you might have might cost you money, but it might be totally free. It might be that Has anyone ever asked Cory why he, really needs to have a day off on Wednesdays? Why? Because there's a treatment I have to have, or there's a sick family member I have to attend to. It's small things like that that organizations can do that'll help people actually feel better in the workplace.
Yeah, just by and to your point, sometimes just by making it okay to have the conversation and to remove the obstacle, it's one less thing that person has to potentially get distressed about. And then it's holistic, it's kind of like the other day I was saying, I my daughter, um, she needed to be home from school for a day, and it was concerning me. I was like, oh, how am I going to ask for this? I was like, I got to put in the request, and I hope they don't get upset. And then I thought after a few minutes, like, why am I concerned about this? I was like, I have the vacation days. It's well within my rights to ask for a vacation day. I was like, there shouldn't be any obstacle for me to ask for a day off to stay home with my daughter. And I got to thinking, I was like, see, that's a bigger and a more important question is why do I feel concerned about asking for a day off?
Yes. But again, a lot of that, and the other thing I'll say too is that often when conversations like that come up, that there are some who look at that and say, "Oh, that's just the people don't care." Sometimes they actually do care. It's not that they don't care. It is that many of the systems that we've placed people in were not set up to care. The people care, but we have a rule that says you have to do X, Y, Z. Of course, that rule was written 40 years ago. And it was written under some totally different environment, but we haven't changed the rule. So now we're in a post, I don't know if we're totally out of the pandemic, to be quite honest, but there's less visible signs of a pandemic, but we've had a new experience. It's okay for people to work at a distance, even in the public sector. The job will still get done. We proved it for a couple of years. So why is it that the person has to report to an office? Because we always have. Why is it that they can't do that remotely? Well, because we didn't used to. I mean, there's no real reason for it other than a practice that really could be changed to help folks in the situation you're in, and being clear with people to say, look, it is more important that you feel safe and that you feel that you've protected those, because ultimately you taking that time to care for your daughter is going to cause you to come back to work and care for the public a little bit better. It just is. Just is.
I just had a thought is the same kind of thing. I was reading a book. Um, it is about the special operations in the military, and they had a quote from one of the um, I think he was the platoon leader, but he was telling the rest of the platoon. He said, when we get on the plane and we're going downrange, we're going to be under stress and we're going to be expected to pull through and do these things under less than ideal conditions. He said, anything going on that can be resolved before you get on the plane, he said, let's do it now. If it's something involving finances or housing or your pets or whatever it is, he said, because that's one less thing that's going to concern and or distract you. And well, of course, that's talking about a war. To your point earlier, same kind of thing would apply if you're a firefighter or if you're an EMS or if you're a police officer. It's there are things that they may seem benign, but they can certainly add up, and certainly the anything that gets more acute, hazing, bullying, any of that, that's definitely something that needs to be addressed because it's going to get in the way.
Right. Absolutely. So, uh, um, you, I think we'd be both preaching to the choir to tell each other this, but for those out there who have this view that, what are you people in the public sector crying about? It can't be all that stressful. You get a job and generally you'll get to stay there as long as you want. And, the pay might not be great, but at least it's stable and the benefits are pretty decent and blah, 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 blah. And then there are the other folks. And again, folks certainly have a right to do it. who feel like, well, I don't think we need to have all that stuff anywhere. I'm just not really into government. So they then think that the people in government are somehow not human. So talk about those who don't believe that the public sector is stressful or hazardous to begin with. How do you share with them some of the concerns, particularly in the groups that you deal with?
Yeah, that's certainly relevant. It's interesting because I, I was actually just talking about this the other day with one of our team, and I said, the thing that gets either overlooked completely or it gets cognitively minimized by a lot of people is that number one, in the public sector, you're taking in what would be in the private sector all of these different industries. Like if you look at the BLS data, Bureau of Labor Statistics, you've got all of these industry codes, pages of industry codes. All of that's in the public sector in the same municipality. We have everything from somebody that makes the signs on the road, to somebody that paints the stripes on the road, to somebody that takes care of patients in a clinic, to somebody that uh, sterilizes the drinking water. It's all being done simultaneously. I always tell our new employee orientation, I say, "J- just the city of Houston, not counting the greater Harris County and all of the other municipalities that surround the greater Houston area. Just the city of Houston is 669 square miles, 2.31 million people, and all these people doing all these different jobs that make the thing work. And if any of those people don't show up for work, something's going to get missed, and that's a big thing that the politicians tend to lean into is, I'm going to make sure your trash gets picked up. And I'm going to make sure that the pothole gets filled. And, all those are jobs that people do. So that's the first thing is that because you have all those jobs, you have all those hazards. And any hazard that exists under under the sun is going to exist in the municipality. The second part of it that makes it the risk level go up is that every one of those jobs is public facing. So if you're working in a so for example, I wrote an article about this where I said if you're working in a factory, which that was my first job out of the Air Force was in a factory. So you've got, for example, your kind of prototypical factory. You've got a blow mold, you have a filler, you have a packer, or a blow mold, filler, labeler, packer, palletizer, and then a forklift picks up the pallet and they drop ship it. So at this point now, if you've done your risk assessment for each of these different processes, here's the engineering controls, we got the interlocks, we got the procedures, we got the PPE. So unless something changes, you follow that procedure, you're going to minimize the risk. Um, the thing about what we do, whether it be public sector or even healthcare or anything public facing, is that now you've got unpredictability in there, and the risk changes depending on the location, the people you're working with, the people you're talking to, um, and so it just opens it up to so much more that you've got to be able to identify, observe your surroundings, identify risk, orient to what your protocol is, what the risk controls are, and then be able to do that before something blows back at you. And that in itself is taxing. It's exhausting. Like the example I was using earlier about the warming center. We do those typically every winter. We get a hard freeze, and either people's electricity goes out, and so they don't have a heater, and especially for the unhoused population where they're going to freeze to death on the street, and so we bring them all in, and so even somebody whose only job, so they're a volunteer, their regular job is they work at a multi-service center, they administer a youth program or whatever it is. So they volunteer to come work in this warming center. They come in there, just something like I'm gonna be at this table. People are going to come up. We're going to give them a MRE and we're going to have them sign the paper. Just that, you're going to have people that come up, they yell at you, people that spit on you, people that they threaten you. So you do that for 8 or 12 hour shift, and just the process of having to constantly be aware of, is this person about to yell at me? Is this person going to swing at me? After that, a lot of people came to me. They said, I'm done with this. Like, I didn't sign up for this. And so you take all that, you add it up over time, and to your point earlier, also, people process things differently. So some people, it's going to be more difficult, and that just it's something that a lot of people don't, unless they've been there, they don't necessarily uh, relate to it. And so that's where we get a lot of the concerns. They say, "Oh, this is all socialism and this is nonsense." And you're going, "Well, do the job for a day, and then we'll talk about it." It's really see it. You got to feel it more so. That's kind of my perspective on it. The public facing and the unpredictability. It takes it up a notch, makes it.
Yeah, again, just really, really important points, and I like the kind of the practical nature that you're using to to describe this, because people can relate to, look, I'm only going to work at this shelter for a couple of days. It's not my full-time job. It's not like I'm not a social worker. I'm just a person who does X, whatever X is. Now you're asking me to do Y, and you're asking me to do Y in an environment that is unusual, even if I was trained. But the other thing I'll suggest, though, so psychosocial hazards come from three sources: the work itself, how the work's organized, and the people who do the work. And the third one, again, you mentioned it, in the public sector, is the most complicated. You, you know how to set up a shelter. I mean, you can have a whole plan and a bunch of stuff in place, and you can have shifts set up. The difference is the unpredictability of the people who you will both work with, even internally, and who you'll be serving. You have no idea what that's going to be there, and there is no way to predict it. You can kind of make guesses based on last time, but every time is going to be different. Every situation is going to be slightly different. I do recall I was in the Atlanta area when Hurricane Katrina occurred, and like a lot of other cities in the South, and if I'm not mistaken, Houston was another city that received this huge influx of people because something happened someplace else. They go to the next big city, and now you've got your own things going on, and now these other folks have shown up, and there's, well, as much as some people may want to do it, we are one country, and we don't build walls around the city of Houston and say people can't come, so they show up. And when they show up, there's things that need to be done to keep all of us safe, not just them, to keep all of us safe. So again, these are the very complex kinds of situations that public sector workers get involved in, that the private sector would say, "Well, that doesn't make money. I don't want to do that, so I'm out." But somebody has to do it.
Exactly. And to your point, that's I had this thought actually a couple minutes ago, and it's always so interesting as far as the initial perception of the risk. You know, you can take any group of people. You may have 10 people, and you'll get 10 different versions of what that risk looks like, and that was the thing that was so interesting about going back to the pandemic, of course, is before anything can happen, you've got to have a consensus on, this is what the risk is, this is the characteristics of it. So like you said, with chemicals tend to be objective. You can say, here's the chemical, here's the label, here's the SDS. It's teratogenic, it's mutagenic, whatever, it's carcinogenic, and it's not open for argument. It's science. um, but when you get into things that people can't see or smell, it 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 opens it up to different perceptions, and perceptions can be based on people's lived experience and whatnot. And so with the pandemic, before we even got to the point of, okay, how are we going to stop the spread? How are we going to protect the responders? How are we going to do recovery, with vaccinations and whatnot? How are we going to measure with contact tracing? Before any of that even started, which those were all hot button topics, very divisive. Just the first question, it's like, what are we dealing with? Is it a pathogen? Is it airborne? Is it um, is it blood-borne? Is it whatever? And just those questions, people got heated. They say this is not airborne, and we are not recommending respirators. And we're going. In a lot of cases, it was so funny because we had there were some people they would want to fight about it. They'd say it's not airborne, it's droplet. We said, okay, but if it's droplet, well, you're still saying it comes from the mouth and nose and it spreads in the air. It just may not spread as far. I say, but if you're within, you know, striking distance of somebody, even if it's just droplet, wouldn't you want to be protected? And it was so interesting because those perceptions were varied, and people were so entrenched. Yeah, and then once it got to the political level, the politicians were now either validating or not validating those positions, and then they were basing political campaigns on it. They say, "I'm running for this office on the pretense that I will not require source control," or, whatever, and it was really eye-opening for me. For years, I was going, "Wow, this has turned a situation of hazard identification, assessment, and control into a political soapbox." It was trippy. So, yeah, to your point, if as long as there's a difference in perceptions, it's always going to be difficult. Yeah.
That's right. Well, I will say one thing. It is kind of job security for safety professionals because and the other thing that I think is really important is there's a lot of discussion in society about risk management, but not enough discussion about. So risk is the product of vulnerability to a hazard. And again, to the point you just made, the challenge was people couldn't figure out what the hazard was. They, they what is it? What is it? Let alone how it travels. What really is the hazard? And if we can't trace it back, this is one of the reasons, and shameless plug here, one of the reasons why I've written this book that's called Psychosocial Hazards Are Real, just to get people to don't even identify them, just figure out they exist at all. I mean, that's where I'd like people to get that they're a thing at all, because there are some who just don't believe that how people feel matters. They don't think it matters. And I'm here to suggest, and you've given so many really clear examples, how people feel does matter, because the actions that they're going to take. And I looked this up recently. About 80% of our decision making is emotional in nature. We're not logical. You can have all the data and facts and figures and whatnot that you want. We make decisions based on our emotions. And if our emotions tell us that something is threatening to us, our prefrontal cortex shuts down and the amygdala takes over and says, look, get me safe. And until I'm safe, I don't need to talk about anything else until I feel safe. And it doesn't matter what the facts and the figures and the history and the last study and the last thing that was done over in Pakistan or Pasadena. It doesn't really matter what happened elsewhere. I don't feel safe. Therefore, I'm going to respond in a way that shows you I got to get this safety thing handled, which again like I said, is a wonderful opportunity for safety professionals. So before we go, I would like the thing that's really unique about you, and again, shout out to the folks in the city of Houston. And this is my assessment, outside looking in, I should say, that you all have one of the most effective occupational health and safety programs of a local government that I've ever seen. First of all, there aren't that many to begin with. That's not to diminish what you all do, but most major cities don't have a citywide singular focus safety program. They'll have something over in public works and police are doing something, and fire, the kind of quote unquote high hazard folks do their own thing, but they're not really coordinated. And so from that experience, from the opportunity to work with the city, if you could share just a couple of words as we start to wrap here, what are some suggestions you would give to a city that wants to do a better job of looking out for the safety of their workers, particularly the high hazard ones, but the rest of them as well?
Yeah, absolutely. So the one of the primary, you know, I guess objectives that I've been trying to work on throughout these last 10 years is to provide at least a starting point, on how to take these things that can often be perceived as abstract, because like you said, a lot of these things people would look at, and even people that are occupational safety professionals, they'll go, I don't deal with, you know, chemical threat agents, and I don't deal with radiological dispersal devices. That's for, there's a firefighter that does that, or there's a police officer or whatnot. And same with workplace violence. There's people that say, I don't deal with that. Call 911. And so I've been trying really diligently to make sure that people know that these things can we I'm not saying we should be trying to do the job of a police officer or a firefighter or whatnot. That's definitely not the point. But I'm trying to say that these things can be handled within the context of a safety management system. So if you break that down into what I call the big seven, you've got, okay, so we have our infrastructure, which means we have our subject matter expertise and the people that know about these different types of risks. So we get the right information. So I'm not trying to play guessing games, pretending I'm a nurse or whatnot. And then from there, we can look at the different risks. And so we know what the hazard identification as well as the risk assessment. And that also includes, taking into account the whether it's predictable or unpredictable, if it's stagnant or dynamic. And then from there, we can methodically figure out the risk controls. So we've got can we eliminate, can we substitute, the hierarchy plus the regulations plus, I always put in John Boy's OODA loop with, the observe, orient, decide, and act for situational awareness for those unpredictable factors. And then you've got your training, and then from there you got your communication. So the trainings to teach them how to use the controls, the communication so they don't forget the training. And then you got your leading indicators. That's to validate it. So we can check to see if the conditions are safe, if the work practices are safe, and then situational awareness, good catch reporting and things like that. And then you get your lagging indicators. And so if we keep that cycle active, then it's kind of um, like flypaper, if you will. Like it catches these things as they come up. You know, it takes the guesswork out of it to a degree. For example, like I did a briefing. I was again. I've had a series of lucky breaks where I got asked to do a briefing for the FEMA higher education conference a couple of years ago about this, about the pandemic response with the city. And that's what I was explaining there was I said, historically with the incident command system, they're going to write the incident action plan and they're going to write a singular safety plan that's a page in the incident action plan. I said, but that's written on the pretense, like your prototypical fire response is here's the IAP, here's the safety plan. We're going to roll in here. We're going to set up the entry control point. We've got our hot, warm, and cold zones. We're going to put out the fire. We're going to decontaminate, and we're all going to go home. But when you get into these extended responses, whether it's a disease response like a pandemic or even a natural disaster or things like that, it goes on to where that cycle will loop day in and day out. And so something, for example, they come to me the second day of the pandemic response and they said, hey, we had a backstock of N95 respirators and they are all unserviceable. So what now? He said, okay, well, that changes things because now we got to see, can we buy N95s? Are they NOSH approved? Are they serviceable? Do people pass a fit test with them? And so if we're not running that loop, just something like that means we might not have respirators. They might not pass a fit test. They might uh, they might not seal. And so then we have people that are going within 6 feet of people that are potentially infectious. They're not protected. Now we just infected that whole team, you know, um, and that's in the first 30 minutes of the day. So we said it's something we can't look at it as abstract and unprecedented and uncontrollable. Um, but at the same time, it's not your standard, you know, hazard ID, risk assessment, hazard control. We're done. It's something it's got to be recurring and ongoing. But if that's the case, then we have a much better shot of mitigating risk with these naturally unpredictable situations. And so I believe that's where, if you look at like a Venn diagram, you got occupational safety, you got your first responders, infection preventionists, and right in the middle of that is where you got this gray area that I work in, and so, um, any way that we can collectively make it better all around, it's not only it's gonna make it better for the safety part of it, but because people feel more confident and they perceive it to be a a concerted effort to make sure that people are safe, and we're saying, hey, this is gonna be tough, go get it. They get the psychological part of it. They feel better about showing up for work. They don't feel like, we're just gonna throw them out there and hope for the best. And if that makes, even one person feel better about it, then it's a win. Um, so I just hope I can help with that.
Absolutely, absolutely. Well, Corey, thank you so much for sharing your depth of expertise in a lot of topics, but specifically around this issue of safety. And I, I'm not wearing a cap, but I would tip my cap to you for the service that you've provided not only to our nation but to the industry as a whole, and continue to focus on the folks in the public sector. I will always have a spot in my heart for the public sector, and I try to encourage others that whether you care about the people or not, you should. I think that would be a good thing, but it's your money. And when they get hurt, you get to pay for it whether you want to or not. It's not like the private sector. If so, a private sector company, if I don't buy your product, I also don't have to accept any of your risk. It doesn't affect me at all. But in the public sector, you cannot separate yourself. If someone in our federal government gets hurt, I pay for it. Someone in the state where I live gets hurt, I pay for it. Someone in my county or city gets hurt, I'm paying for it. And at the very least, in diminished services, and in some cases in the cost of their care or the cost of their replacement. So again, we're probably preaching to the choir on this one, but hopefully others are listening in and will think about the importance of addressing high risk kinds of activities in the public sector. So again, thanks so much. Appreciate your contributions. And as just before we go, though, if there are those who are watching or listening to the podcast for the first time, welcome. I hope something you've heard will bring you back in the future. Previous episodes of the podcast can be found at psychhealthandsafetyusa.com. You can watch, like, and subscribe or share the podcast on the Flourish DX YouTube page. Please do join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to David at id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.